sterilization of instruments using dry heat oven. So I'm just going to be giving an introduction on what exactly the process is and what are the instruments that can undergo this process. So basically, for sterilization of instruments using dry heat oven, the dry heat oven is also known as an autoclave. So what is an autoclave? The invention of an autoclave sterilizer is attributed to Charles Chamberlain in 1879. Around that time, researchers started to understand the advantages of sterile surgery, and doctors needed a more reliable sterilization method than open flaming. The autoclave's benefits were soon evident, and it became an essential part of every clinic and hospital. An autoclave is used to sterilize surgical equipment, lab instruments, pharmaceutical items, and other materials. It can sterilize solid, liquids, hollows, and instruments of various shapes and sizes. Autoclaves vary in size, shape, and functionality. A very basic autoclave is similar to a pressure cooker. Both use the power of steam to kill bacteria, spores, and germs, resistant to boiling water and powerful detergents. So over here we have the oldest autoclave, which looked almost very similar to a pressure cooker. And here we have a modern autoclave. Moving on, so what is an autoclave used for? An autoclave chamber sterilizes medical or lab instruments by heating them above boiling point. Most clinics have tabletop autoclaves, which I've added a picture here, similar in size to microwave ovens. Hospitals use large autoclaves, also called horizontal autoclaves. They are usually located in the central sterile services department and can process numerous surgical instruments in a single sterilization cycle, meeting the ongoing demand for sterile equipment in operating rooms and emergency wards. Small autoclaves, also known as tabletop autoclaves, can be found in dental offices. So how does it work? A medical autoclave is a device that uses steam to sterilize equipment and other objects. This means that all bacteria, viruses, fungi, and spores are inactivated. However, prions such as those associated with Creutzfeldt-Jakob disease and some toxins released by certain bacteria such as cerulide may not be destroyed by autoclaving at the typical 134 degrees Celsius for 3 minutes or 121 degrees Celsius for 15 minutes. Moving on, the items sterilized by autoclave. Many surgical items such as forceps, needle holders, scalpel handles can be autoclaved. Autoclaves are of particular importance in poorer countries due to the much greater amount of equipment that is reused. Because damp heat is used, heat labile products such as plastics cannot be sterilized this way or they will melt. Paper and other products that may be damaged by steam must also be sterilized another way. Autoclaving is often used to sterilize medical waste prior to disposal in standard municipal solid waste stream. This application has become more common as an alternative to incineration due to environmental and health concerns raised because of the combustion byproducts emitted by incinerators. After this, the actual method and the procedure of how autoclave is done will be explained by Jane. Thank you very much.